Welcome all. Again, we are live for another session today. First of all, congratulate to all the females, all the female doctors. It's an International Women's Day, and we are very much happy and we are very much pleased to have this live with all of you today. And today, a very important topic we'll be discussing. We have a very esteemed guest today, Mamta Verma. She's the founder of Gandharva Wellness Studio and having a vast experience in wellness and beauty industry. So, without wasting much time, I hand over the session to Mamta for initial discussion and introduction. And I request Mamta that if there are some other device which is there with you, people, please keep that on mute because there is some echo in your setup. So maybe you can mute any other device which is
Yeah,
going on, so
yeah,
that we can accordingly,
yeah,
like, we'll be able to listen better.
yeah.
Please, thank you.
Hello,
Yes, yes, please.
hello.
Yeah, this is better now. Please, you can start, Mamta.
Yeah. So, how many of them we have with us?
It will increase. It will increase. I think already around 25, 30 people have joined, but it will increase in a minute. So please start.
Okay. So today is the Women's Day, and all the women. We all of us want to take care of ourselves, and specifically in this time during the pandemic, the need of taking care of our body has increased very much. As a woman, there are a lot of issues which we face at different phases of our life. One is when we attain puberty. There are problems which are related with it, like young girls are facing PCOD problems nowadays very much. Because of that, there is a weight gain, there is excess hair, and they feel not good about the way they look because there is a lot of bloatedness on their face. So we need to address that. We need to see how Ayurveda can help us out in it, and what we should do in our diet pattern and all that. Second stage is when we are going for the major problem is when we go through perimenopausal problems, which is happening at an earlier age nowadays. Like, after 35 only a woman starts sensing that something is not going as usual, and by 42 43 the symptoms becomes very high, and within few years there is a lot of problems. So it is not only the physiological problem which worries the woman, it is also the emotional turmoil which she goes through during this phase, which is something which we need to look at. We need to find a way how we can make this journey little more easy. And the third is the menopausal stage, when we have attained menopause, and our mothers are of the same age group. Like, we do not know, like, they don't know how to take care of themselves. The bones are becoming weak, they are not feeling good. So we will be taking Dr. Piyush help today, and we will need to understand what is it which a woman should do in all these three phases of her life, to take care of herself. Hello, hello.
I think definitely we all need to understand as far as hello. Definitely we all need to understand as far as hello. Yes, you are there, Mamta?
Yes, yes, I'm there.
Yeah, please proceed.
Yeah.
So I think
So,
there was some technical glitch, so I think we are again live.
okay. So I have to start from the beginning.
No, I think you can continue.
Okay. So this is what we are here today, like to understand, like how Ayurveda can help a woman, how like a little bit of the more organic way of handling these phases of our life, like we can help with the PCOD problem which women go through, perimenopausal, menopausal. So let us have a like little input from you.
Yeah, sorry. I think there was some technical glitch. Now it is resolved. So thank
Yeah.
you again for all of you joining. And as Mamta mentioned about certain aspects, so we need to understand as a female health is concerned, there are several challenges, there are several aspects which are there. And first of all, again, I congratulate to all of you. Today we are celebrating International Women Day. And in fact, all the females, all the women in our life, be it our mother, be it our partner or wife, daughters, whatever, granddaughters, your friends, your professional colleagues, uh, anywhere you see that, I think they are very important and eternal part of our life. And sometimes, in fact, being a male, we are unable to understand the challenges, the health problems, the health issues all the females are having. And being a doctor and being a practitioner, and in Ayurveda, when we started our practice, um, we have seen that the female health issues are very much these days. And with due respect to all the pathies, with due respect to all the system of medicines, still there are not so many solutions. In fact, healing or cure or permanent solutions are not there. We have seen so many females are suffering from several issues like hormonal imbalance, that is the topic of our talk today. Then to the gynecological disorders, specifically the pain they are having every month related to their menstrual cycles. And PCOD is very common these days, certain issues in terms of the gynecological health. So we have seen that many females are suffering, and they are suffering from years, and they don't have a permanent solution for that. But in Ayurveda, and with the diet and lifestyle management and all these holistic approaches, we have seen somehow we are able to get a good solution, sometimes permanent solution for several females from our clinic, from our setup. We have seen that. So my request to all of you today is, when you are listening to this session, and please disseminate this information, please spread this information across your community, across your society, across your domain, that yes, there are solutions available to all the female health issues. And these solutions are safe, effective, sometimes permanent solutions are also there. And because, see, ultimately, end of the day, as I said, that all females are an internal part of our life, be it personal or professional. And we should understand that aspect, that they should remain healthy, and then only the ecosystem can be managed or be balanced. So that is my request to all of you. So please spread this word, and I request all of you to post your comments, your questions, your queries today. We are looking forward for an exciting and informative session. So, Mamta, what we can do is, maybe let's have one by one some specific topic of the day is the hormonal imbalance. So, maybe you can start with some aspects, and then I will add on to that. And meanwhile, we start getting some queries also. I will be putting one by one in between, so that we can have an interactive discussion today.
Okay. So the most important problem, like because we are into wellness and a lot of people come to us. Usually nowadays, mother comes to us very panicked. Like my daughter is like 17 or 18, and she's facing a lot of problems. Her periods are not regular, and she's having these excess hair, and she's not feeling good. Her face is not looking, her skin is not nice. So, which is basically, in most of the cases, it is the PCOD problem, which is the problem. Uh, yeah. So, what is the solution? How do we go about it? Like when they go to the gynecologist, they put them on some hormonal treatments. So, what is the natural way of bringing that balance which has gone absolutely for a toss nowadays, maybe, which I have I mean, there are a lot of things which are of course contributing towards it, is the vegetables which we are eating are having so much of pesticides in it, so much of hormones is being injected into the food which we are eating. The water we are drinking is not very clean. There's a lot of stress with the childrens are going through. So what do you suggest, like what a mother should do at that time when her daughter is facing these problems, and she's very this thing very about going to the gynecologist, because that also brings a lot of problems to the girl if she goes through those treatments, and eventually they find out that it is not definitely the solution. So what do you feel, like what is it in Ayurveda, which is such an ancient science, how it can help these mothers and their daughters to have a better health, and the daughters can live this beautiful moments of their life, which is the teenage, or the youth, the peak of the youth, to the bestest of their this thing.
Right. I think a very important aspect you have raised today, and we have seen in last few years. I have seen in our practice, and what the feedback we are getting from the fellow practitioners also. So there is a significant increase in the trend of hormonal imbalance problems like PCOD and all these issues from the teenage. There are some research studies and there are some like data available that many societies, and in fact in our country also in India, early puberty is also on rise these days. Girls are getting puberty in a bit early age as well. And as we all are having these kind of aspects with us, so we know the secondary factors. It's an internet era, everybody is exposed to all the aspects. So there are some challenges also. As a parent we need to understand. Now, as a physician, as a clinician, we recommend first of all we need to check the diet and lifestyle. That is very, very important. In fact, to every hormonal imbalance case, to every case where we see that a particular kid, particular teenager is suffering from certain issues where they have hormonal imbalance, where they have challenges in terms of their monthly cycles, they have acne, they have hair fall, they have mood swings. Many aspects are there as a symptom. So we need to understand that there are some kind of, it's natural. In fact, it's natural process that they will be going through the tremendous hormonal. I will not say imbalance, but it is like a kind of sometimes it is on peak, sometimes it is down, and they are having this phase of their life where they have to face all these challenges. So first of all, we need to be very much supportive to them. We need to understand that what kind of stage they are. We all have been to that stage. Second, these days the life and diet and lifestyle is very, very important. The sedentary lifestyle, they in fact not doing any kind of a walk or cycling or any other physical activity. Many times I have seen, especially with the female kids, the teenagers. So that we need to encourage. The more and more, at least they should indulge themselves into some kind of a regular, any kind of a sports they can play, outdoor sports by the way. We have seen in COVID era everybody was locked down, so all of them have been into the internal scenarios, but now people are coming out. So first and foremost, I recommend to all the parents, to every kid, be it male or female, that doesn't matter. But if we are talking about the female hormonal imbalance issues today, so they should indulge their child, their daughters, in any kind of regular physical activity, be it a walk, be it a cycling, skipping, uh, sports, whatever she is interested. Please, in dancing by the way, it's a very good activity. They can join a dance class. So whatever they want to do, please, as per their interest, involve them in some kind of a regular half an hour to 1 hour kind of a routine, apart from their studies, apart from whatever they are doing. That is very, very important. Second aspect is diet. So now in diet we need to understand, okay, fast food is fine these days, everybody is ordering from Zomato, Swiggy, or whatever is going on, that is fine. But the home cooked food, the fresh fruits, fresh vegetables, all are having a very significant role in this entire scenario. The things we are eating, the food we are eating is directly impacting to our hormonal life, hormonal balances in our body. And we have seen when we have changed the diet patterns, the way when we have changed the diet ingredients, and the more they are eating fresh, the more they are eating healthy, it is easy for them to manage these issues. So 50% of the problems can be managed with the modification of diet and lifestyle. There is no medicine is required of any pathy, by the way. Still, if you feel that there are issues, still if you feel there are like problems with them, you can always start with some herbal solutions. And for that, I strongly recommend to at least consult once with the nearby Ayurveda practitioner to get it at least one or two simple herbs. They can be simple herbs which you in day to day life they can just mix it with their milk or take it with water or a tonic or whatever. It's not technically still medicines, but these herbs can benefit her as per her profile, her prakriti, her overall stage. Any good doctor can recommend you a couple of herbs which you can include in her regime, and she will be fine with that. That's it. So technically, we're not saying that these are medicines, but yes, if they have some pathology, if they have some issues, we have to do some kind of ultrasonography scan, and we have find that okay, they are having PCOD or they are having any other issues, then definitely there are some medicines available which can help them without. See, hormonal or those kind of therapies or treatments are always the last option. But when we modify diet and lifestyle, when we do these herbal additions, herbs in their routine or some herbal medicines, 80 to 90% cases are easily can be healed. Still, if there are some other issues, we can always recommend and go to the specialist also. But the process and the pathway and the flowchart or the ecosystem should be like this, that you have to proceed step by step, so that ultimately end of the day she is a growing child. We don't want to expose her to strong chemicals, to strong hormonal medicines, because that will impact her in a very bad way. Sometimes I have seen so many cases that impacted that kid and that child, that daughter, in a very negative way as well. Sometimes, with due respect to my fellow practitioners, we are strongly against of exposing any kind of a chemical or hormonal based treatment until or unless it is the last resort for them. So that we need to understand. We all are moving towards plant based food, like all the ingredients. We all are moving towards getting vegan. We all are moving towards organic life. We all are moving towards whatever pure and natural we can get. So then, why to expose our kids? Why to expose our daughters to the harmful chemical based solutions? So please avoid that. And there are, and in fact, centers like you, the wellness centers, you have so many holistic therapies which I know. So I think all these can help them a lot rather than just directly exposing them to the chemical based solutions. That is my input on this.
Yeah, that is what I wanted to ask you. Like these young girls, they do get benefits from the body therapies or the Ayurveda massages which we give, because it also relaxes their nervous system to a certain extent, which absolutely is in a stimulated state because of the hormonal imbalance in the body. Now, second thing is, doctor, that a lot of people talk like for example at Fab India and all these kind of stores, Satabri is very much available. Like people just want to tell every woman, yeah, you take Satabri, it's going to be good for your reproductive health. So what do you say about it? Do you think anyone can take it, or what is it like? Do we need to consult a doctor, or and who which woman can take it? Because this is like, these are like chavanprash for the women, like every chavanprash every person can do. The Satabri, okay, like every woman should take Satabri. That's what people, these companies, they say that's a good herb. So what is your suggestion? What do you advise?
No, excellent question again, Mamta, and I strongly like we strongly avoid these kind of communication. See, what happens is we need to understand. On one side, Shatavari is one of the safest herb. There will be no harm to anyone who is taking Shatavari. In fact, some males also sometimes we have to recommend. It's not a like only females can take. Many times we have to recommend or suggest to certain males also for certain indications. But yes, predominantly this particular herb is for female health issues, and kind of an OTC. We will say that every company is selling that you should take Shatavari in the form of powder or capsules, or some people have some drinks also blended with this herb, and many other formulations are there. Now we need to understand one aspect to this and into all the other herbs and all the other plants being promoted directly. See, there are two aspects, and it's a very simple fundamental which you need to understand. If any plant, if any herb, if any ingredient is in your kitchen right now, at least you can take that as a food. But these herbs, and in fact those things which are in your kitchen also, sometimes if you increase the dose, for example you have black pepper in your kitchen and you are using, all of us are using as a very common spice these days, but in Ayurveda we are using black pepper in a strong potent way, or sometimes in a more dosage form, which generally we are using as a spice, and maybe in some other form as a medicine as well. So the same herb, one side is a spice for us, and the same herb is a technically a medicine also for us, but in a various forms of dosage, in a different potency, in a different way which we are taking from that particular plant. Now that is a very basic aspect which defines and which differentiate a food and a medicine. For example, Shatabri, I don't think so is there in our kitchens. So we don't want to criticize, or we don't want to comment on any company's business model, but as an Ayurveda doctor, it has been taught to us, and we know that every individual is different. So sometimes, and although as I said, this is one of the safest herb, still some people can be allergic. Some people can have some issues after taking this herb. And Shatavari generally we recommend and we give in good dosage form to the lactating mothers, especially because it enhances the lactation. So sometimes we got this complaint that when teenagers started Shatavari, they can have certain issues which they are not supposed to at that age, right? So we have to deal it with some maturity. And again, I request, any herb you want to start, especially for the teenagers, please consult with your doctor first and then start. That will be the best way to take it forward. As I said, diet, you can have all the fresh fruits, you can have all the fresh vegetables, especially vegetables, those are growing upwards, means like vegetables, those are growing in the small plants, in the form of the crawler plants, and all these vegetables are better as compared to the underground vegetables. So in that way you can have all the green vegetables are better, all the pulses are better for you. So these some options which we need to understand, which are better in terms of the food. And again, the herbs which are being promoted or marketed as directly you can take as an OTC herb, again it is their business model. But as an individual, you need to understand whatever you are taking inside your body, you should first of all evaluate and judge, or maybe have a discussion with a technical person whether it will benefit you or not, or maybe we can have some side effect, or it will not be having any side effect initially, but in long term usage it can. And I will not say side effect, but it can impact your health and impact your gynae health in some way which it should not be there. So that we need to understand, and accordingly we need to take it forward. Otherwise, predominantly it's a pretty safe herb. If at any point of time your doctor has suggested you and you have started, you can take it for a long term as well. There will not any serious issues if somebody is taking Shatabri. Otherwise, it's a very common and very widely used herb across the globe. And Ashwagandha is also good, by the way. These days I have seen many teenagers are having a very significant amount of stress and anxiety and tension. Technically, medically, it's not stress. Sometimes they are having anxiety. They're not able to sleep well as well. Sometimes they have insomnia. They used to, uh, they have this schedule that they are waking till 1, 2, 3 a.m. Sometimes they are watching some web series these days, OTT platforms, or they are doing studies also sometimes in long hours in night during the examination time. These days, boards and all are scheduled to be start in April. So they will be like right now, they will be busy in their studies and all. So all those things are impacting their sleep, their mental health, their psychological health. So ashwagandha is again a very good solution which they can take. But again, please get a consultation, get an advice from your nearby doctor, and then you can start. And if it is recommended, you can very well start. And on the same note, like for example, you people are doing therapy, so I strongly recommend Shirodhara sometimes, because again, several parents are still not accepting that their children or their teenage daughters should get anything inside their body. But some external therapies, they are fine and they are comfortable. So Shirodhara is one of the therapy which can help to release their tension, their psychological stress or anxiety, and especially if they are not able to sleep. With few sittings of Shirodhara, I've seen people are sleeping well, and they are managing their overall psychological health as well. So these type of therapies also sometimes help, and sometimes like make them relax as well in their overall health, psychological health, if we talk about.
So I think the conclusion we can make is like for these adolescents and for these very young girls, it is the combination of everything together: the right diet, the nice physical activity pattern. Like they should at least, like I advise to everyone, like for 30 minutes, every girl should run. So right combination of the activity pattern and some support from, if in spite of all these also the hormonal imbalances happen, they should consult a good eye with a doctor, and whatever the doctor suggests according to the prakriti of their body, because that's also very important, they should follow that this thing. And the combination of the therapies which they can come for to the wellness centers or ayurveda centers, they can come for the therapies which will come, also help them out majorly. So this is about the young girls. Now we'll come to the age group which is like 40 plus. So most of my the doctor, the very peculiar thing, a very important crucial thing which I want you to highlight and help the women is, like, usually nowadays what's happening is most of my friends who are 40 plus are having irregular periods. They are having too much of abnormality in their period. Is it the menopause which is approaching? Do they need to handle it like a menopause, and they just need to take care of it, or they need to get relaxed about it, that's a natural phenomena which is happening? Or is it something else? Like, how do they know that what it is actually, whether it's a premenopausal symptom, or it is something wrong with their reproductive health, which needs attention, which needs a medical support, or ayurveda support, or some kind of a therapeutic this thing. So what is it actually, what is happening to the women of these 40 plus who are having these irregular periods? What is the root cause, and is it something to they need to get worried about, or what is it?
Right. So, as I said, when well, like we are talking about the teenage or the puberty. So, as I said, on one side we are seeing early puberty. On the other side, we are also seeing early menopause these days. So, generally, what happened was if you go to like around 10 years or 15 years back. So, generally, females were having their menopause in either late 40s or early 50s. But now we are getting patients, and we are getting these cases where female generally are getting menopause. In fact, not early 40s, some late 30s also cases I have seen that they are getting menopause. So that is one aspect which we need to understand, that when a female is approaching towards the menopause, there will be certain irregularities. But now there is a confusion also sometimes. So sometimes the symptoms, the issues are like this, and they have been diagnosed with a premenopause syndrome, PMS, but technically it is not. And sometimes we have to again judge and see the entire case, and then only we can decide. So first of all, my suggestion to all of you, if you are having any issues in terms of your gynecological health, in terms of your psychological health, sometimes, in fact, I have seen many cases are referring being referred to the counselors or the psychiatrist or the psychologist, but technically they are not a psychiatric patient, or they are not a psychological patient. They are having these hormonal imbalance, they are having these issues, and due to which they are like having this mental health issues. So when we heal those hormonal imbalances, when we heal those gynecological issues, their mental health will also get automatically healed. So that we need to understand first of all, and accordingly we need to get it forward. So when you are having these issues in terms of your mood swings, in terms of you're not able to sleep, and you have done all your checkups, still you are not able to identify what exactly is going wrong, then you can at least consult a good doctor and identify that exactly what is happening inside you. And we have seen, as one side I have seen that I've said that this menopause is a bit early now. It's a shift from the late 40s or early 50s to mid 40s, sometimes early 40s and late 30s also. Second aspect which we need to understand is, see, again, with the mid age crisis, I will say, or many of the females either are they are occupied with the household work, they are in a transition of from their household, now they again want to restart their professional life. Many aspects are there, they're already professionally successful, but somehow they are managing all the aspects. So there are many challenges going on with all the females. So that also we need to understand, and that is directly or indirectly impacting their physical health as well, and especially the gynecological health. So that aspect also we need to take care. And I recommend all of you to at least have once annual checkup to be done, because there are some issues which, if being diagnosed or being identified at an initial level, we can have a very good solution and that can be resolved, like initial levels of any kind of cyst or PCODs. PCOD, by the way, can happen in later age as well. It's a myth that many females are saying, okay, I don't have in teenage, how I can have in the midlife or maybe in the 40s also. But it can happen, and we have seen so many cases where they don't have any history in the teenage or in the younger age, but they developed cyst, ovarian cyst or PCOD in the 30s or 40s as well. And they will not able to identify the symptoms, like they again, by the way, like many females are coming to me in their mid 30s or late 30s, that we are suddenly starting getting acne. We never had in teenage groups so that age, but now we are getting acne, we are getting hair fall, we are getting blemishes sometimes, or sometimes they are having early aging kind of signs which should not be there in their age group. So all these symptoms can be a trigger that something is going wrong inside your body. So please have some checkups, please have some scan, please have some investigations to be done. Sometimes we have seen that everything is normal in ultrasonography report, and people get relaxed, okay, I am fine, my ultrasonography report is normal. But please check your hormonal levels in your blood, because many times we have seen that ultrasonography report is pretty normal, but blood hormones level are imbalanced, and vice versa. Your blood hormone, sometimes some people are going for blood hormone levels, those are normal, so they say, okay, fine, my hormone levels are normal, so I don't have any issue. But when we have seen their ultrasonography report, there are some kind of cyst, fibroids, uterine fibroids, or their endometrium layer is either thin or thick. All these can impact directly or indirectly to your gynecological health. So my request to all of you is, have a proper checkup, have an exhaustive checkup whenever you feel there is something wrong, there is some issues, you are feeling lethargy whole day, you are not able to get up in a fresh way, you are not able to sleep, anything which is wrong with your mood aspects, your psychological health, whatever you feel is wrong, that can be a trigger with you. So at least have an annual checkup, visit your gynecologist, get all the examinations done. And again, as I said, with due respect to all the pathies, Ayurveda has several solutions for these issues, these problems, and with safe and effective remedies, along with certain therapies, certain overall external therapies like abhyangam, shirodhara, all these aspects, we can easily manage several issues. I think we have already started getting so many questions as well. So what I suggest is, meanwhile, one by one, we can have some questions and then we can continue our discussion. So that will make people like engaged with our session, and that will also ensure that we are involving them. So let me take the first question, and maybe Mamta, you can also add on to this as per your experience, because you are an expert in wellness, beauty, and all those domains as well. So Rishika is asking that any suggestion on helping with scalp treatment for young adults. I have been suffering from the age of 15, 16, diagnosed with thyroid couple of years back. Nothing helping as such. Is it because of hormonal imbalance or climate change? You are suffering, and again, she has mentioned that she is suffering from dandruff scalp from a long time. See, now we need to understand this dandruff. In fact, many times I have seen dandruff is being misdiagnosed with certain other issues. Like, for example, a very common problem is psoriasis, and many people are still not able to diagnose whether they have dandruff or they have psoriasis. Both have scalings or flakes in your scalp when you see the clinical representation. So, first of all, is it technically a dandruff or any other issue that you need to identify? Second, is still a dandruff, not psoriasis. So then you need to also understand that as per your prakriti in Ayurveda, we determine prakriti. So if you are a Vata person, you are a Pitta person, or you are a Kapha person, that we need to determine, because generally we have seen either in Vata or Pitta specifically, this dandruff or these scaling is predominant as compared to the Kapha. Now, if you are that kind of prakriti, so if you are using certain herbs which pacify your elevated dosha, that will help you in getting this issue. Like, for example, all the individuals can't use the same hair oil. We have customized hair oil also to an individual as per their prakriti and as per their vikriti. Vikriti means disease. So if you have this scalp this dandruff, you can use a certain particular hair oil. You have to change your hair oil, shampoo, and a regular, maybe a kind of a lotion or serum. All these are herbal based, which can address that. Point number one. Second, you can have certain therapies also and certain external aspects also. Definitely you must be having, because you are suffering from last so many years. But still, maybe you can uh, check that what exactly you are taking right now and what can be the change. Third, as you have mentioned, yes, hormonal imbalance can be one factor. Climate change can be one factor. In fact, the water from which you are washing your head, the diet you are taking, so many aspects are there which can be the trigger. So I again recommend. I don't know whether you have taken any proper treatment till now, but please get a treatment for your this problem. And in Ayurveda, along with certain therapies, there are good solutions. And maybe Mamta can throw some light on some therapies which you people are
Yeah,
dealing with this particular
yeah.
problem. Right.
Yeah. So the most problem, like in all these years of my, with the wellness industry, the major problem of the hair fall and the dandruff is the wrong kind of water which we are using to wash our hair. That is the very basic and the common reason behind the bad hair which we are having nowadays. So first of all, the first step needs to be to take care of the water. It needs to be the soft water. It should not be the hard water. If you're washing your hair with hard water, nothing on the planet earth can help you out with your hair issues. The second is that we need to the second problem is that the shampoo which we use nowadays, they're very they have a lot of chemical a lot of chemicals in them. So we need to take care of that. The shampoo should not be very harsh, and they should be diluted. If we have to use a chemical shampoo, it needs to be diluted with water. Or my suggestion is that we should shift to the ayurvedic consultations or herbal shampoos to wash our hair on the daily basis. And the third is definitely you need to take care of your diet. The nutrients in the diet should be good. You should be taking enough of iron, you should be taking enough of protein in the diet, and minerals, the other minerals, to so that the hair growth happens. Like magnesium is also very good. So that is what is also important for your hair. And we have a lot of ayurvedic treatment lines, and the combination of some oils and some mask which nourishes your hair. The oil, the scalp massage which we have forgotten. See, in earlier days, like our mother used to make us sit, and she used to put oil in our scalp, and she need to massage it herself. We have forgotten that. Let us adopt these old practices, because they are the real solution of these problems. So if you're taking a nice, if you can't do it at home, you can come to our centers. We can give you nicely medicated hair oil therapy with nice mask which can clean your scalp, and which can nourishes your hair also. So again, for the hair problems, you need to take care of the water, the diet you're taking, and cleansing, keeping your scalp clean. And still, if you have an issue, you need to consult the doctor for any medication support. And my personal suggestion is we should take support from Ayurveda, which is a very good um, medicinal line which can help us out.
Yeah, in fact, one user I just got, we are uh, getting it live from our platform as well. So we keep on sharing some tips. On one side, we strongly recommend to that you visit doctor and you visit some experts, some good centers to get the entire treatment protocol. But on the other side, there are some home remedies, and definitely we should not sound that we are just asking all of you to maybe visit our center or all. So let me just give you a quick tip today, and it is very effective, by the way. We have seen in many patients. So you can try this, and as Mumta said also, that you can try something initially, and if it does not working for you, you can always consult us. We are all available for all of you. But still, you want to try, you can try this. So get a good bringraj oil, by the way, and get one complete lemon. You have to squeeze the entire lemon in that, and 3 to 4 maybe pieces of camphor. You have to just dissolve that fresh when you are preparing that mixture, and just apply that in your roots, and it is very effective when we have seen in managing certain cases with primary dandruff and initial kind of a scaling in the scalp. So lemon and camphor along with a good bringa oil are very like it's a very good combination, which we have seen is helping several cases in our setups also. So you all can try this, and please let us know if it worked for you. You can share feedback on. We are live right now on Gandharva Wellness page. We are live right now on Yum Plate with Foodies page. We are live right now on our platform. We are right now simultaneous live on around six platforms, and I can see many of you are watching us live on these different platforms. So please do share that how this tip helped all of you. Now the next question is that both my kids are obese, and lifestyle changes. Beside lifestyle changes, how can Ayurveda help them further? This is again a very common issue these days. All these kids, teenagers are getting obese, overweight, and again the the basic reason and the main reason is sedentary lifestyle and irregular diet pattern. So these two we need to check first of all. And when we are see, Ayurveda will work, or any other therapy or any other treatment will only work when you correct your diet and when you correct your lifestyle. If you're not doing that, then definitely we also have limitations. But yes, in overweight cases, in obesity management, in weight management, to be very specific, we have very good therapies, we have very good solutions as far as weight management is concerned. And in Ayurveda, as far as in the external therapies, there are specific oils, there are some specific therapies and treatments for weight management we are doing at Gandharva, and we are seeing very good results. And in Ayurveda, there are specific herbs, specific medicines, specific treatments available, which are, because sometimes we have seen that we got this feedback, okay, I have done all the diet restriction, I have started rigorous physical activity, I am doing certain kind of sometimes therapies or treatments also, but still sometimes the stubborn fat, the cellulite, or the inch loss or the weight loss is not that much speedy which I want to achieve. In that scenario, we can add certain couple of herbs with your treatment protocols, and it can give you a very good result. We all know about Vic Shamla, it's very much commonly used these days, but again, please do not start without a medical prescription, without a consultation. We have certain other medicines in Ayurveda which you all can always start. All of them are pretty safe. These herbs and these medicines will never damage any organ or any other thing. It will just like ensure as a catalyst that reducing your extra body fat only. So that has been researched and that has been proven in the scientific studies as well. And we have seen in many cases it is showing us a very good result. So yes, for both of your kids, we have excellent solutions. And on that note, I again request Mamta to add what kind of weight management therapies or what kind of external treatments people are doing at Gandharva, so that people are aware that okay, these especially for the kids, as she has mentioned. So what kind of external aspects we can club along with the Ayurveda treatments which are available?
Yeah. So if the child is more than if the child is like 17, 18, there is a combination which we call Techno Ayurveda. There are certain appliances which can be used, which can increase the metabolism of the system of the body. Along with that, there are good Ayurvedic, therapy like Udvardhanam, which is a very good ancient therapy, which
Right.
helps in the fat mobilization. It increases the blood circulation in the system. It detox your body system, and the fat starts, the fat disintegration happens. Along with this, there is a very strict for this child. So the younger children's, the more important thing is the right kind of diet. Now, right kind of diet doesn't mean making them feel hungry or giving them some kind of boring diet, but we need to be, as a mother, we need to be very very educated in what kind of a right diet which my child finds interesting to eat, I need to work upon. And of course, sending him to the some sports activity, or sending him for some swimming, or some kind of workout is very very important. So I will suggest that for this age group, a mother needs to learn very well what is the nutrition management, what is the food the child should be given, along with some kind of support which we can give with the help of the therapy if the child is really really very obese. And also nowadays, a lot of children, because of this pandemic, are going through a lot of emotional turmoil. It is not a normal life which they have lived in last 2 3 years. So we need to look at that as well. We need to talk to them openly. Maybe sometime what happens is some emotions get stuck in the body in some way, and the child start eating too much, or he's depressed, he doesn't eat, and obesity happens. He doesn't want to get involved in any kind of activity, social activity, so the movement is very less. So we need to address that as well. So these kind of cases, I feel that the support from professionals is very nice. You should bring them sometime here, and we can connect you with good people, like the nutritionist can speak to them, they can help them out. And the for the mental emotional well-being also, we can support you in certain way. And in if the ayurveda, if there is some certain imbalance in their body system, ayurvedic medication can also help them out. So that is what it is. So now, doctor,
Right.
quickly I will move to the third phase of a woman's life, which is like 70 plus. Like all our mothers are going through this phase. Of course, their generation didn't had a lot of exposure. They do not expect much from their body, like, because usually in India after 50 only people think अच्छा हम बूढ़े हो गए हैं now, हमारे को किसी चीज की जरूरत नहीं है. They start losing interest in living a very nice and active social life. So but how do we, what is it which they can do to to have a better day, mean to say the energy in the body is little more. So the two main problems which usually they fail is the feel is the, of course, the low energy levels, and second is the problem in their bones, like they have usually these knee joint pain problems, so their movement gets restricted. And the third is they face this urinary tract infection quite often. So what is it like, how we can help them with the energy levels, higher energy levels, so that they get active in their daily routine, and the bone health, and this UTI which they usually face. How Ayurveda can help in that? If some solution you can suggest.
See, first of all, we need to understand, as we are discussing about the senior citizen population, the geriatric age group, the people who are above 50, 60, or in 70s. So in Ayurveda, we have this domain known as Rasayana or Rasayan Chikitsa. We all know about Chavanprash, that is the very common being used or being marketed product. But again, good quality Rasayana, good quality Chavanprash are very less, very few. All of them are just marketing, but the quality has to be there. So in Ayurveda, Rasayana or this entire domain is talking about when we are getting aged, when we are aging. There are so many issues which we are there, which are there with us when we are in our 50s, in 60s, in 70s, and with females, several additional issues are there because they are dealing with after menopause. They are dealing with so many other issues. Osteoporosis is expedite in them as compared to males, and there are so many other issues are there. So and yes, you are absolutely right. They are sometimes isolated, they are sometimes not involved or engaged socially, or many other aspects are there which directly or indirectly impact their psychological health as well, and that again like impact the physical health. So we need to understand that first of all, this rasayana or this overall domain is in Ayurveda is talking about how to take care your that age group. And as you mentioned about that energy level, so if they are taking good rasayana on a regular basis, like simple like ingredients, like for example, amla is one of the best antioxidant. So what we need to understand is when we age, the more and more free radicals are getting increased in our body. Free radicals are destroying or damaging our cells, means we are already dealing with a cell destruction. Already our body is aging, and if we are losing more and more cells, then we will definitely have low energy levels and we have certain other health issues. But if we are taking something that is known as antioxidant, a natural antioxidant, and what antioxidant do, this act as a scavenger, means they eat free radicals in our body. So when we take a regular dose of antioxidants, they reduce the free radicals in our body, means our cell damage and our cell death is reduced, means we will be remaining active and we will be remaining young for years. So we have seen so many people in their 60s and 70s also looking young, or maybe they are fit and active and energetic. So they have a good amount of antioxidants, and these days these plant based antioxidants should be there in our diet, and amla is one of the widely used, one of the safest antioxidant which we all can take. We can take raw, in raw form. We can take several preparations, as I said about chawanprash. And in chawanprash, along with amla, there are at least 50 herbs which are there to manage our aging, specifically. And as these days aging is starting from 30s, not 50s. I have seen so many people in 30s with gray hair, with wrinkles, with so many other issues which generally should be there in 50 or 60. So that means we have early aging problems also. So it's not that you have to wait till 50 to start rasayana, to start chawanprash and all these things. No, you have to start from 30s to live a good quality life in your 50s and 70s as well. Please
Yeah.
understand that.
So
So
yeah.
second question, yeah.
So I wanted to ask, like these Prash. So in summers, we can take it. I mean, what are these cold these Prash? The new range of Prash which has come, like you can take it in summers, and what is it like?
Again,
What
see,
basic?
again,
Yeah.
again, first of all, it's not a season specific rasayana. You can take in all the seasons. It's a myth. It's a like confusing aspect. It's a confusion that you can't take Chamanprash in summers. Now, some companies are marketing that okay, I have put pearl moti, or I have put gulkand or anything which specify the pitta, or which specify the heating effect of Chavanprash, so you can take in summers and all. That is fine. See, again, Chavanprash is just one example. There are hundreds of rasayana available in Ayurveda, and I've just quoted that example because all of you are aware about this. But there are hundreds of rasayana, and there are so many rasayanas which you can take in summer season as well. So that's why I'm saying please always consult and always discuss once. With the it can be one consultation for your entire lifetime, as far as you want to add some rasayana in your regime. That's it. You're not supposed to on monthly basis again and again consult them for at least starting some kind of a rasayana, so that you can straight away in just one consultation you can figure out that okay, this rasayana is best for me and I can take in summers as well. On the other side, in fact, for pitta people, for highly elevated pitta people, sometimes Chyawanprash can have issues in winters also. So again, it will be individual to individual basis, and then accordingly we need to plan that. Second aspect which you asked about the bone health. So again, as we all know that after 30, bones start depleting the calcium and osteoporosis starts. Especially in female, it is a bit elevated, and in 50s, 60s, 70s, it's such a it will be at a very pathetic level. So if we are having inclusions in our diet in terms of healthy calcium intake, and if you are a vegan, if you are a vegetarian, you have limited options as far as having good calcium in your diet. Non-vegetarians can have many options to have this calcium in their diet, but for vegetarians, especially for vegans who are not taking dairy also, they have to be very specific and very like judicious in terms of including certain ingredients in their diet, who will ensure which will ensure that they have an adequate quantity of calcium in that. Like for example, sesame seeds. Sesame seeds are a very good natural resource which you can have in your diet. Vitamin D will always be there with the sun exposure. There is nothing which you can just take. In fact, all the medicines, all the supplements, all the shots or capsules or sachets which you are taking are the precursor of vitamin D, and you have to get your body to expose to the sun. That's why the international travelers or the people across the world are lying without clothes on the beaches and all. It's not just that they are enjoying that, they know the importance of vitamin D, and they know if they are aging they have to expose themselves the maximum they can to the sun to get that. But that is not possible at all in Indian culture, especially for the females, if you're talking about the female health. But at least whatever the visible part you can expose to the sun, please do that, along with the good amount of calcium you have to take. And there are some natural options, the calcium being sourced from the natural origin like seashells or many other natural sources are available. So please again consult with your practitioner and add that in your regime. It will be good for your health. And third, sorry, I missed the third aspect which you mentioned.
The UTI problem which they face.
Okay, right, UTI. So see the UTI again. Just a second. The UTI again, we need to understand there are two three reasons for UTI. One is actually what happens is in 60s and 70s we have seen the urinary bladder incompetence means many people, and it's with males also, they are not able to control or they are not able to manage or retain the urine pressure, and the urinary bladder incompetence is there, and there can be several reasons for that, and due to that some kind of dribbling or some kind of urge of going urination, and due to that UTI is recurrent and many times it is occurring. So it will get more technical, but to be very specific, UTI can also be managed. There are several herbs again like Punarnava, Gokshru, or these kind of herbs are very good for urinary health to manage urinary tract infections. Again, please consult your doctor. In Ayurveda, there are several solutions. Have plenty of water, by the way, fluids. You have to have plenty of water in your. I have seen so many people are not drinking adequate water as per your body weight, age. Have at least 1 to 2 liter, 2.5 liter of water, or in totality the fluids. And by the way, the number of cups of coffee or tea if you are having in your daily routine, you should subtract by double amount of fluid, because they are dehydrating. Caffeine is dehydrating effect. So if you are taking 2 cups or 3 cups of tea or coffee, please add 6 cups of water to that, because generally what people say, okay doctor साहब I am taking 2 3 glasses 4 glasses, फिर तो मैं चाय भी पी लेता हूँ, कॉफी भी पी लेता हूँ, इतना सारा फ्लूइड तो हो गया बॉडी में. नो, these will have dehydration in your body. Like for example, some people are taking alcohol, some people are taking other these kind of drinks, again they all will cause dehydration in your body. So you have to hydrate your body with plenty of fluids. So juices can add, water can be added, sometimes certain kind of soup can be added as fluids, but these coffee, tea, alcohol, all this has to be subtracted from that fluid intake, and then only will be justified. And many times I have seen in India specifically, especially for the females, they are drinking very less water, they are drinking very less fluid, and that also can be one primary reason for UTI, for urinary tract infection in this age group. So that we need to understand, and accordingly we need to check that as well.
Yeah, and I also would want to share that to this particular age group, like they are aging now, their life is changing. We need to help them out in keeping this life force alive in them to feel excited about life. So you should get them sometime nice haircut, which they do not know what kind of difference it can bring. Maybe some nice hair color, facial. They really enjoy when they come there to our centers. They enjoy facials, and body therapy also is a very strong support. You have no idea if your mother or if you yourself is of this age group, if you are taking the body therapy or the ayurvedic massage on a regular basis, how much of a difference it can make in your overall health. So these are the tiny little things which we should support them, or if we need to, if we are of this age group, we need to take care of it our own self. And it is going to be a nice thing for them also. I mean, a lot of medical problems can be saved if your body is stress free, if there is no the muscles are relaxed and your system is completely got rid of the toxins. It's a very good support for the woman. I think many questions we are getting, doctor, we should address them.
Yes. So we have some questions, some more questions that I again thanks all of you. I can see from last 1 hour all of you are attending the session live. So quickly let me take few more questions, and all of you are now, we have opened the session. All of you can post your queries and questions. We can discuss one by one in whatever the remaining time we have. We planned for 30 40 minutes, but I think we are more than 1 hour now, and due to the support and engagement from all of you, it is very encouraging. And thanks again for attending this session today. So quickly, how to cure uterine fibroids? See, uterine fibroids again have several aspects when we are dealing with. Sometimes we have seen with medicines they are getting dissolved. Sometimes we have seen with certain treatments like Uttarvasti, means the medicines are being infused through vaginal route, and it is getting dissolved. and sometimes we have to go for surgical interventions also if it is not responding from medicines and these therapies. But yes, we have seen in many cases, 60 to 70% cases, we have seen resolutions with either medicines or these external therapies, and we have to save the uterus, because the problem with surgery of uterine fibroid is there is no other option, just to they have to they have to remove the uterus from the body. That is the only option if there are multiple fibroids. So we, our intention and our motto is to save as maximum as we can, and we have seen in our clinic and like in our practice. So I recommend, if any case is there with uterine fibroid Tripti, you should immediately consult to a nearby Ayurveda doctor. You can connect with us. Our informations are available on all the pages where we are live, and whatever the best maximum way we can help in that scenario. Then another question is, what happens when there is hormonal imbalance in body? I think we are already discussed this in the entire session today. So a very interesting question, by the way. Do men have hormonal imbalance too? Absolutely. See, we all have hormones. It's not about females only. Males also have hormones. And by the way, okay, let me just quickly give you this brief understanding. So there are two hormones which are responsible. One is testosterone and one is estrogen. Now, if any female is there, if any male is there, both hormones are available in males and both hormones are available in females. It's not that females only have estrogen and males only have testosterone. No, all the males will have testosterone as well as estrogen. Estrogen will be recessive and testosterone will be dominant, and vice versa in females. Females will also have testosterone and females will also have estrogen, but estrogen is the dominant in the large quantity or the higher levels, and testosterone will be at a very minimum level, right? So both of them have both the hormones. Now, if there is any imbalance in females, if estrogen is less and testosterone is more, or there are many other hormones as well, by the way, and in males also, if testosterone level is having imbalance and estrogen or other hormones levels are having imbalance, so definitely they will also suffer. In fact, they are suffering, and the problem is with male, many times either they are not accepting, they are not getting diagnosed, they are not getting investigated. They feel offended sometimes when we talk to them, especially I want to emphasize, we get so many infertility cases these days, and with due respect to our society and the cultures we have, many times I am seeing as a clinician, as a doctor, that every time people are just blaming or just making female responsible for the infertility. No, they are just the 50%. 50% is the male partner, and many times they are even not at all getting diagnosed, they are not accepting, they are not ready to get investigated. And when we have investigated, 50% or sometimes more than 50% cases are having the male involvement in terms of the infertility is concerned. There are so many issues with the males. That's why the couple is not getting baby, or they are not able to plan their family. So please understand that all the females, all the senior females, all the males, whosoever is attending this session, please understand, it's just equal, it's just 50-50 among males and females in terms of any issues are concerned. Specifically for infertility aspect is there, please never make only female responsible for infertility. Males are equally responsible, and in fact sometimes more responsibility relies and owes to males as compared to females. And yes, they have hormonal imbalance, very pathetic way they are getting impacted. I have sympathy, and I have that understanding that in our society, especially in India, males are not allowed, or males are not supposed to discuss these kind of issues. But yes, they are having challenges, and definitely we will be talking on this aspect as well. Nice suggestion, by the way. So, but yes, they do have. Again, next question is some suggestions for acne breakouts during puberty. Yes, we have already discussed that hormonal imbalance can be one reason, and that can be the reason for that. And for acne, we have so many good ointments as far as herbal ointments are concerned. We have some internal medicines as well. And I quickly request Mamta to throw some light as far as acne treatments are concerned in your center or maybe in your professional life. What kind of suggestions and what kind of maybe options you want to suggest to the people who are listening to this, because acne is a very common problem these days for teenagers, for middle-aged people, for senior people also sometimes we have seen. So what can be your suggestions on this acne problem?
Yeah. So acne basically happens when the sebaceous glands becomes hyperactive because of whatever reason, because of the stress which we have in our body. That is the reason when during the exams, or if there is usually before, just before the wedding, the bride faces these problems. So when the stress and the anxiety in the body is too high, and which is leading to the imbalance in the hormonal system, which is leading to hyperactivation of the sebaceous glands. So when they are hyperactive, they secrete a lot of oil, which if we have a dead skin on our face, the dead skin doesn't let the oil come out. And the acne, the bacteria attacks and the acne formation happens. Now, definitely the solution, the main solution is definitely to take care of it, that we should not, the body should not feel this stress. So of course, I always tell everyone that the 80% solution of our medical problems or our health issues is in the activity pattern which we are choosing and the diet which we are eating, right? So if a person is running for 30 minutes or 1 hour, believe me, a lot of problems can be cured. But if the remaining which leave behind, if you're not able to do all this, then you have to the so I never suggest anyone to tamper with your hormonal body, if to go to the doctor and they advise you certain hormones to bring the balance and going for the complicated test process. I always say that then take care of it, that the skin should not have the dead skin, and they should not, the oil should not be left for a longer duration on the skin. So you have to keep using the right kind of toners. You need to take the face cleanup session on the regular basis, and there are a lot of anti-acne treatments available, like peel also, chemical peels also sometimes need to give to the person if the acne is very severe. But there are a lot of good products, like which has got a lot of aromatic oils which takes care of the acne problems which you have on your face, like right kind of mask and exfoliating the skin in the right way. The combination of all this can give you a very good result. So anti-acne treatments are very much there, and you can combine the Ayurvedic medication with the right facial. And if in case you need, at a severe case, if you need some cosmetology or a dermatology support, that also should be taken to a certain extent.
Right, absolutely. And again, thank you all of you for joining today. We just quickly having the last set of questions now, and accordingly we'll be proceeding for the conclusion. But again, it was a very nice session and a very nice engagement I can see right now. So, any foods that need to be avoided during menstrual cycles? Yes, specifically, please avoid too much of spicy and too much of citrus food as far as specifically during the menstrual cycles are concerned. Have as maximum you can home cooked, you can have food from outside also, but avoid too much of spicy and too much of citrus. Also you need to understand that during that time you can have small meal also. And if possible, please avoid any kind of smoking or alcohol also. That is advisable, and that will ensure that you have a healthy or a pretty fine and normal menstrual cycle. And especially if you are having some health issue, you can always consult your doctor, and accordingly you can take it forward. Right. And okay. So why do young girls have unwanted facial hair, especially on the chin and neck area? Very good question, Asma. See, what happens is, as I said, in males the testosterone hormones are more, so that's why we all have facial hairs. But in female, the hormones are not that much, so you like females don't have. But again, if we have unwanted facial hair, means first of all there is an hormonal imbalance that we need to check. This can be due to PCOD, this can be due to other health issues as well. So first of all, we need to diagnose the root cause. But after that, when we resolve that issue, still many times we have seen that patients, they stop cases, they stop having new growth, but there is some existing growth. That you can again, we have certain therapies in Ayurveda, certain labs are there, and some skin and derma therapies and treatments also to remove that unwanted facial hair. But first of all, we need to understand the root cause, the diagnose, and we need to heal that. Because if you go for some therapies also, but recurrence can be there if you're not healing the root cause. That you need to understand, right? So there has to be two dimension approach. One, check the root cause with your doctor, get it diagnosed and get it healed. On the other side, you can have the external therapies and treatment. So Mamta, quickly you can just let us know what kind
Yeah,
of external therapies or
yeah,
treatments people have
yeah.
in the facial
Yeah.
layers.
So let me be very, very clear. There is no other solution to the hair which you already got on your chin or on your side locks, on your upper lip, than laser hair reduction treatment through the appliance, through the machine. So whatever else you are doing, you need to stop plucking your hair. You should not wax it because it is leaving your skin with lot of open pores and undergrowth, which is making it not looking nice. So laser hair reduction is a treatment which you should opt for as early as is possible. The when you start having you start realizing that we are having this kind of excess hair which is not looking good, and it should not be there. That's not the way the face should look with the long hair on the face. So laser hair reduction is the only treatment which is good, which is very good for to go for if you have excess hair on your face.
Nice, nice, great. Thanks for this information, Mamta. Okay, so I have been diagnosed with high BP. It is like 145, 107, and I am 49 years of age. What should I do? You should immediately check with your any nearby doctor. You can connect with us as well, because this is a bit high as far as your blood pressure levels are concerned. There can be several reasons. One, there can be higher level of cholesterol or triglycerides in your blood. There can be certain issues with related to certain organs like kidney and all. There can be significant amount of stress or anxiety in your life, due to which you can have these kind of levels, or maybe there are some other reasons as well. So first, get it checked, get it investigated, what exactly is the specific reason for your higher blood pressure level, and accordingly you can start the treatment. In Ayurveda, as I said, there are very good herbs which can help you in terms of managing your high BP levels. And but first of all, we need to identify the cause. So get it investigated, consult a doctor as soon as possible, and accordingly you can take it forward. But yes, it is manageable, and with very safe solutions, safe herbal solutions, you can manage your uh, higher BP levels or hypertension, to be very precise. So thank you so much again. I think it was a very nice session, although we have exceeded our time limit and duration, but it was always nice to interact with all of you and to have this kind of discussion, because this is a very special day. We dedicate this day to all of you, all the females in our life, and again, thanks to all the females in my life as well, be it my personal or professional life, to make our life beautiful. We can't imagine this world, this globe without all the females. So thank you so much, and we are very much there to support you, to help you. In fact, we need your support and help. But sometimes, as a practitioner, as a clinician, as an Ayurveda doctor, I always say that all the gynecological issues, health issues, are very much manageable, and we have seen in our clinic, in our experience, that many of the females who have been healed are now living a very good and quality life. So please consult any Ayurveda doctor near to you to get it resolved as far as gynecological health issues are concerned, and we have an excellent solutions in that. And we know, and we know the importance of each one of you in your family, in your personal and professional life. So we want all of you to be healthy, we want all of you to be happy and to flourish and to nourish all of us. So thank you again, Mamta, for your time, for this wonderful session.
Yeah,
And
I
it will
also.
it will be available on our platform. I got couple of queries that they were not able to listen for some time. Maybe you were be having some bad network, so it will be available on all the platforms, on Gandharva, on our platform, that is indianvedyas.com, and on the other platform, Yum Plate with Foodies. Thanks for the collaboration today. So it will be available on all the sessions. You can always rewind and rewatch the entire session. Yes, Mamta,
Yes,
please.
we can do that. So I also would want to wish all the women on this platform today who have attended this session a very happy Women's Day. Cherish your body. God has created you, which is a very it's a very soft this thing, but a very strong being. Take out time for yourself, go out for walks, enjoy the food which you make yourself also first. Don't worry about that what food my other family like, I should only cook that. Cook something for your own self, read books, enjoy the nature around, and also meditate for some few minutes in a day to connect with your body and feel its presence and enjoy your womanhood to the complete.
Great, great. Thanks, all of you. Have a great day ahead.
Thank you
Thank
so
you.
much. Bye.
Bye.